Good afternoon, everyone. My name is Mirjam Bonen, and I work at Functional Neuroimaging, Cognitive and Mobility Lab. I'm very grateful to be here and to be able to talk about a subject that is very close to my heart and that is sometimes dubbed in my lab my baby. I'm very happy to see some people here that helped us with this study. They're right there. And we are always very grateful for your help. I have a lot to go over, so let's get right into it. Physical activity and Parkinson's disease. I am certain all of you are aware of its importance in the management of Parkinson's, for which there is currently yet no cure. This means the focus is on mitigating the symptoms, maintaining the highest level of independence and quality of life. The management of Parkinson's disease is a combination of different aspects as seen here. Education and support, medication, of course, and exercise or physical activity. Where is it here? And as we all know, exercise is medicine. We have to take it every day. This actually really means a shift in paradigm in terms of compliance with exercise, if you want to reap the benefits of it. There's also an increasing body of research about the frequency, type, and duration of exercise. I will come back to that later, but for now, it looks like we are missing something very important, something that takes the most of our waking hours in terms of time. There is, as you can see, if I can find this here, there is something peeking out of the forest right there. Over the last 200 years, with the Industrial Revolution, we have become a sitting society. Look at us. We were never meant to sit behind a desk or in a lazy boy staring at our screen or TV all day long, like we're doing now. Or sit on the couch with the cat on our lap, reading our favorite book all day long. I really would love to do that, but it's not good. It has become more and more clear that sitting for prolonged periods of time has detrimental effects on our body and on our mind, for that matter. If you look at this important slide, it becomes clear that even if you exercise vigorously, let's say for an hour a day, but you sit for the rest of your waking hours, say 9 or 10 hours, the net benefit of your exercise is lost. The reason being that exercise physiology and inactivity or sedentary physiology actually have different effects on our body, and these effects are independent from each other. This is a fairly new concept and a bit hard to grasp. Even for me as a physical therapist, it took a while. This was not taught to me 40 years ago when I went to school. And it took me a while to understand, but it really comes down to this. If you want to take care of your health, you should not be sitting all the time. I quickly want to go over some definitions that are often used interchangeably and therefore quite confusing, but they are important to understand. First, there's physical activity. This encompasses every movement, every activity we do. Now, this can be divided into physical exercise, which is defined as planned, repetitive movement with goals in mind, as well as non-exercise physical activity, which is all the other movement that we do or should be doing throughout the day. It is this type of physical activity that I will focus on in this presentation. The other presentation will focus more on exercise. Now, every physical activity, whether it's exercise or non-exercise, can be of low, moderate, or vigorous intensity. Again, we will get back to that in the other presentation as well. And to make things even more confusing, physical therapy, which is often used interchangeably with physical exercise or physical activity, is actually something completely different. It is a medical intervention by skilled individuals. and they often prescribe physical exercise or physical activity. I understand if you are a bit confused right now. I was too for a long time. But in all seriousness, it is really important to keep these terms separated. I will come back to these slides in the afternoon presentation as well. And then, of course, there is the time where we are not moving, which we call sedentary time or sedentary behavior, which is when we are sleeping or sitting or reclining. Just to move. All right then, the creature peeking out of the woods here is all the time we should or could be spending on what we call non-exercise physical activity. Here are some examples of non-exercise physical activity. You can see housework, gardening, and I'm sure you can come up with some examples yourself. I especially like this one, bring your grocery bags in one at a time. Who would ever do that? Not me. Remember the last one though. Get up every 5 minutes for every hour that you sit behind a desk or a computer. This is a very doable and effective way to mitigate some of the negative effects of sitting too much. With our modern devices, it's very easy to just set a timer and get up for a bit. I guarantee you, it will feel good. Okay, sorry, I have a bit of a dry throat here. Okay, so maybe someone can get me a bit of water, that would be great. You can, okay, I appreciate that, thank you. This was the background for our study that I'm going to discuss now. It is well known that physical therapy is helping in treating many of the motor features of Parkinson's, like balance, for which medication is not always helpful, gait, double tasking, fine motor skill, general strength and endurance. However, it is also clear that without a proper follow-up, the gains that are made in physical therapy will fade. They will return to baseline. The literature mentions 3 to 12 months, depending on the type of therapy and gains we are talking about. The gold standard of physical therapy of Parkinson's treatment is usually 12. Thank you, I really appreciate that. I don't know. Yeah, I'm going to take a sip here. And let's get, oh, that feels very good. The gold standard of Parkinson's disease management is usually 12 sessions of physical therapy, followed by some kind of group exercise in the community. Luckily, our Parkinson's community has a very strong support system in the Michigan Parkinson's Foundation, which has many local chapters and exercise groups. There's also an abundance of different exercise opportunities in the community. So the question that our lab was asking was, would it be possible to maintain those gains made in individual physical therapy better and longer if we would not only focus on increasing physical activity, like the group exercise in the community, but also focus on decreasing that sedentary time at home? The way we did this was by providing a barrier-free option for people to decrease their sitting time in the home environment. We placed a sit-to-stand desk in their home. Moreover, the desk had a very slowly, and this was really novel, a very slowly moving tabletop. This means that you're not just standing, but you're also weight shifting and stepping. This had several benefits. First, standing still is not comfortable for longer periods of time. Second, the weight shifting and stepping could have a therapeutic effect by itself. Enter the move desk. This is a flow chart of our study. First, everyone underwent an assessment, a pre-physical therapy assessment evaluation. Then all participants received 12 sessions of physical therapy by themselves, individual physical therapy. And then they had an evaluation post-PT, directly after PT. Then 50% of the people got the desk at home and 50% did not. All of them participated in a weekly exercise group in the community. And after 16 weeks, everyone was evaluated again. As you can see, the device proved to be safe and feasible in this population. There were no serious adverse events. There was also an excellent long-term compliance. The move desk was used for an average of 2 hours and 15 minutes daily. You can also see, if you look at these numbers, that 33% of the people dropped out of the study. In a longer study with elderly people, this is expected. None of the reasons for the dropouts were related to the study itself. Everyone, all people, improved in measures of mobility and gait after their 12 physical therapy sessions. This is in line with the literature. Physical therapy is a validated, evidence-based tool in the management of PD. Now, when we look at the post-PT intervention period of 4 months and compared the desk group with the non-desk group, we can see here, indeed, that the desk group maintained their gains better than the non-desk group. So this is between V1 and V2. That is before and after physical therapy, and this is after the therapy and before and after using the table. And I made a very simple slide here, and this is only the desk group. The non-desk group, this would go down in a downward arrow. We can see that the desk group maintained their gains made in PT better than the non-desk group. I already said that. This is a very important finding. It means that decreasing sedentary time in combination with increasing physical activity is more effective in maintaining these goals than physical activity alone. Again, think back to these two different independent physiological processes, the effects of sitting versus the effects of physical activity. But there was more. Some important values in the desk group actually really improved compared to the control group. Let's look at that. First of all, the desk group actually had a carryover effect. They became more physically active, that is beyond the use of the desk itself, if that makes any sense. So they were more active than those 2 hours and 15 minutes that they were actually standing behind the desk. Mineral bone density, lean muscle mass, balance, and sleep improved in those 4 months in the desk group compared to the non-desk group. Fear of falling, depression, and anxiety decreased in the desk group compared to the non-desk group. And most importantly of all, quality of life increased in the desk group, not in the control group. So quality of life improved in the desk group compared to the control group. A few notes about our data. Our final cohort, or number of people in the study, was not big. It was only 14. This is not necessarily a problem, but you need to adjust the statistical methods a bit. If you're interested in the graphs and statistical findings, I can maybe, if we have time, show them in the afternoon. But I kept this out to keep things clear. I do want to point out one thing. All the differences in the two groups that I'm talking about here reached the so-called minimal clinically significant difference, or MCSD. This is a statistic value that shows that the effect that we are measuring has clinical implications for the patients. This is important because in the end, that's what we're trying to do. Find an intervention that is meaningful for the people who use it. We are currently working hard on getting a grant for a larger multi-center study, which will, we hope and believe, confirm our findings. Now, what is going on here? This is a framework that we have used in our lab to try to explain what this intervention is actually doing. Once people with Parkinson's start to have balance problems, or even before that, they start a downward slope towards more and more sedentarism, sitting, which results actually in accelerated Parkinson's symptoms compounded by muscle weakness, which is called sarcopenia. When you look at this downward slope and you look at the effects of this move desk, you can see that at several moments in this downward slope, the move desk counteracted these points. There was more physical activity. Fear of falling improved, decreased. Balance improved. And there were even some measures of sarcopenia and frailty, which I didn't talk about much, that also improved. Where am I? Note that we are not giving a cure of Parkinson's here. I will talk about it a little bit after the break. What the move desk seems to be doing is helping maintaining mobility and independence by mitigating the effects of increasing sedentarism, in this case caused by the symptoms of Parkinson's disease. There is evidence that sarcopenia is more common and more severe in people with Parkinson's than their age-controlled peers, and that this has a compounding effect on the symptoms of the disease. Give you a moment to look at this. Now, I would like you to think back to the slide with the clock, with the 1 hour of exercise plus 8 hours of sitting. There is a very interesting concept called isotemporal replacement. I think you like that, Mike. I have a feeling you like that. Time is a finite resource. We only have 24 hours in the day. So this means that we are not merely increasing or decreasing a certain behavior, but we are always replacing one with another, always. Now, why is this important? What do you think is better? Replacing sleep with sitting, think finishing that computer game or series on Netflix, or replacing sitting with non-exercise physical activity? Now, when we were young, our 24 hours might have looked something like this. Here we sleep 8 hours, we exercise a little bit, we sit in school, and for the rest we were moving about. We were young and we were always on the move. And now it looks more like this. Notice that if you add up sleep and sitting, you are at about 80% of the day that you are not moving. In the research about sedentary behavior, there's a lot of attention to this model. One can understand that replacing sleep with exercise is not as healthy as replacing sitting with non-exercise physical activity. Using this model, we get a more complete picture of the different ways we spend our time. And I'm just going to read those statements to you now from two of these research of these papers. Lerma et al. In 2019 said, replacing sedentary behavior with low intensity physical activity will improve physical function in community-dwelling adults. And this one is really nice. Nagai in 2018 said, replacing 30 minutes of sedentary behavior with low-intensity physical activity decreases the risk for frailty in older adults. Increasing LIPA seems more feasible than increasing moderate or vigorous physical activity in older adults with substantial benefits. Okay, the Nagai study says that 30 minutes of replacement had an effect. Our participants replaced 2 hours and 15 minutes, 5 days a week of sitting, plus the carryover effect with low-intensity physical activity. I think this shows how using the desk, replacing sitting with low-intensity physical activity, can be an important and evidence-based tool to maintain independence, mobility, and quality of life. Thank you for your attention. I would like to thank all the participants and technicians for this study, without whom nothing would happen. My colleagues, Faye, Julia, and Steve, they're not here today, but they're extremely supportive. The whole lab is very supportive, for their help with the presentation, and Dr. Bonin for hiring me and trusting me with this important and exciting project. If you'd like to know more about our studies we are currently doing in our lab, there are some flyers on the table. And we also have some of our fantastic technicians over there. You can talk to them more in detail if you would like. Thank you. Any questions? Is there time for questions? Yes, please.
What is a move desk?
Well, I did say it. Yeah, I did say it earlier. Our desk that we placed in the people's homes is a sit-to-stand desk, which actually has proprietary mechanism that the tabletop very slowly moves side to side. So when you're standing in front of it, it will facilitate you. It will invite you. It will facilitate you not to stand still, but to make small steps to the right and to the left. And it's so slow that you don't notice it. You can do everything on it that you would do on a standing desk. Any activity that normally is done sitting can be done standing behind this desk. And people that are sitting here that have used the desk can probably attest to that. Unfortunately, not yet, but full disclosure, there is a family company that we hope to bring it commercially available in the future. Of course, we are working on getting sufficient data to show that it is actually useful. Yeah. Thank you. Any other question? Yes. Yes, thank you. We do have data of that study. That is like a follow-up of this first study. We do have data. I'm not presenting them here, but they are very promising. Thank you for participating in that. Did you find it hard to do anything behind it? Did you find it disturbing? Can you? Yeah.
And I couldn't stand that length of.
Yeah, well, that's actually part of the things that we found out. Yeah.
And pain was a problem for me, so that was a real problem.
Actually, yes, that's one of the, you were not alone. We found that people who used the standing desk in that arm, their use of the table decreased, whereas people who were in the moving desk arm, their use of the table increased. This is what we found. Yeah. Any other questions? Yes, ma'am.
You mentioned physical activity.
Mm-hmm.
Oh, sorry. Walking, treadmill, what else?
Oh, there's lots of physical activity that you can do. I will actually talk about that a little bit more in the afternoon. But this specific talk was about the non-exercise physical activity, which is non-planned and not with goals in mind. Is that answering your question or not? Yeah, I know, it's hard. I understand what you're saying. There are many ways to be physically active. One of them is to be in an exercise group and to exercise, and another is to go for a walk, go for a bike, go gardening, etc. Anything that you're not sitting is also physical activity. Does that answer your question? You're welcome. Yes?
How does duration, not only duration, but how as well as intensity of physical activity play into this? You know, moving on a desk one side to another very slowly, it's kind of a minimum amount of movement.
Yes. What I can hear all here is that it is still very hard to grasp this concept that there are two ways of being active. The one is where you are really physically, where you are doing robust exercise, you're strengthening, you're participating in high intensity aerobic activity, which I will talk about more in the afternoon. But what about those other 8-9 hours in the day that you're not doing that? Most people spend this time sitting. And that's the shift here that we try to make people aware of, that this needs to be, these 8 hours need to be looked at too. And of course, you cannot be working vigorously 8 hours a day, and you don't need to. What we're actually showing here is that even if you're just standing and stepping instead of sitting, that you are already improving your health. Why is this? Because we were never meant to be sitting for 10, 12 hours in the first place. This is something that is happening to our modern culture, and we are not meant to be that way. It has, and I didn't go into detail here, but when you sit for longer periods of time, there's a cascade of physiological processes that are very bad for you.
Does physical activity that includes high intensity, does that make up for the amount of sitting, or is it two separate concepts?
That's exactly what I'm trying to say. And maybe I can go back to that slide. There. All right. So if you exercise vigorously for 1 hour a day, but you sit for another 10, actually the health benefits of that 1 hour is lost. Because exercise has an effect on your body, which is very good, but inactivity physiology, sitting for 8 hours, has other negative effects on your body, and they balance each other out. So if you are exercising for 1 hour, but sitting for 10 hours, you negate that 1 hour of exercise. That's why there has to be more attention for everyone, healthy people, sick people, in that sitting period. There needs to be more attention to sitting less. And it doesn't have to be replaced with exercising or running like this Puma here or whatever it is, but you need to be active. You need to use your large muscles. You need to be stand upright, put weight on your muscles, stimulate the muscles, the bones, the blood flow, everything. Does that answer your question?
I believe so, yeah.
But it's hard. It took me a while too. Is it time? Any other questions? Yes, sir. So there's lots of different papers out there about that. I think they're still trying to figure that out. They're also, controversial. They don't always say the same thing. Some people say you can do this, some say you can do that. I do know, and I do know what I said, that if you stand up for 5 minutes, this is from the literature, if you stand up for 5 minutes every hour, that already mitigates some of the negative effects of sitting too long. So that is a guideline that you could use. Yeah.
Thank you so much, Dr. Bonin.
You're welcome. Thank you.
We're going to take a quick break.